here. One of them we're seeing, the other one has a computer without a camera. So we've got Jonathan Ferrick. Oh, wait a minute. Hold on. Let me get my little sheet here. Okay. Lieutenant John Ferrick has been a firefighter for 25 years. He's been a lieutenant for 13 years. And he's been in fire prevention for the past 4 years. He runs a public education program called SAFE, S-A-F-E, and he hikes in his spare time. Okay, and then Officer Jon Baily, he's the one without the camera. Well, actually, all right, I might as well introduce you both of them. Officer Jon Baily is a 31-year veteran of the Waltham Police Department. He's assigned to the Community Services Division and has received accommodations and awards from a wide variety of groups and organizations, including the Waltham City Council, the Massachusetts State Senate, District Attorney's Office, Disabled Persons Protection Commission, and National Academy for Elder Law Attorneys. Officer Baily is the department's liaison to the District Attorney's Office regarding matters on elders and adults with disabilities. He has a comprehensive knowledge about statutes and services available that relate to these demographics and is a resource for protective service staff who often need to work hand in hand with the police to help vulnerable victims in times of need. So that's right up our alley tonight, because that's what we're going to be talking about.
And
so yeah, so let me let Eric speak first, okay? And you know, you can either put your questions in the chat, but I prefer everybody to kind of hold it to the end, and then we can just, we can kind of have a dialogue. All right. And if you just raise your hand, you could either, because we can see everybody on the screen right now, you want to raise your hand, like this, or you can use the raise hand function down below, which says raise hand. Okay. All right. So Lieutenant Ferrick, you're on.
Okay. Good evening. I already have you already know who I am, so I won't waste time with that. So what I would like to speak about first, before we get into the PowerPoint and the questions and answers, is just a basic home safety plan and how we would adapt that for someone that's hearing impaired. So generally, the first thing we start with is smoke detectors. We're most concerned about smoke detectors when we're sleeping, because if there is a fire during the day and we're awake, we'll generally hear the smoke detectors. Usually you'll actually smell the smoke before you even hear your detectors go off. So we're most concerned about your sleeping areas. There's a big push right now in the fire service to get people to sleep with their doors closed at night. That can be a good or a bad thing, depending on what type of smoke detector system you have, how thick your doors are, and how heavy you sleep in most situations. In a hearing impaired situation, I would say that sleeping with your door shut is probably a really good idea, because slowing down the path of fire is one of the big things that will keep you alive if there is a fire in your house. So with the detection systems we have for hearing impaired people, I think it would make the most sense. One tip I could give you is to sleep with your door shut. If you have one of these systems that wakes you up at night, which we can talk about later, which many of you are probably already aware of. So the big thing, like I said, so that's the beginning of it. I would close the door at night to start, and then just making sure you have a smoke and a carbon monoxide detector. Nowadays, they're most commonly in a combination together. I recommend you get one that has a 10-year battery. That way you never have to change the batteries. They make them with a 10-year battery now, both the hardwired and the battery version. The regular straight battery version will be a 10-year battery just in the detector. And then they also make a hardwired detector with the 10-year backup battery in case your power goes out. So those I would recommend just to everybody to use the 10-year batteries now. Then you never have to worry about batteries again. They pay for themselves over the course of the detector. Again, make sure you have them outside at least. Your sleeping areas, some people might have them hardwired inside your sleeping area as well. That's very good as well. That's ideal. That's what I was talking about, depending on what system you have. So again, just make sure they work. We want to test them monthly. If you do have replaceable batteries, we want to replace the batteries every 6 months. We talk about changing our clocks and changing the batteries. We have some people out of state, so if you're in Arizona and you don't change your clocks, that's not very good advice. Let's see, we're going, I'll talk about the types of detectors later because that's in the PowerPoint. I just want to basically go through our home safety plan. So if we wake up in the middle of the night and our smoke detector or our vibration alarm or low frequency alarm, whatever is going off and alerts us, the first thing we want to do is check our door to see if it's hot. We want to use the back of our hands. I know some of you might remember this from kindergarten, but we teach the same lessons to the kids that we do all the way through the seniors. And so we want to check that door, make sure it's not hot. If the door's hot, we don't want to open it. We want to go to our window, or if you have a second, slider out to your balcony, whatever you have, you want to go to your second egress, your second exit. Another important thing, we want to have two ways out of our sleeping areas. Depending, if you're in the sixth story of a senior housing complex, there's a different fire plan. But generally, if we're in a one or two type family residence, a one or two story residence, our window might be our second way out. Just make sure we have two ways out. If we have air conditioners in our windows, we want to make sure that we can get those out quickly if there's an emergency, because if your door is hot, you're going to want to be able to go to that window. And if you can't get out of it, at least signal for the firefighters, and keeping that door closed is going to buy us a lot of time. So that's the basics of it. If your door's not hot, you want to crack that thing open, stay nice and low, look into your hallway, see if there's any smoke. If there's no smoke, or if the smoke's up nice and high, if you're able, you're going to get low and get out. If you're not able, you're going to, we call 911 from that location, keep the door shut, put something underneath the door, go to the window, call 911. That's the best thing you can do. If you can get out, if you can self-evacuate, we want to get out. This applies to everyone in our house. Everyone in our house should know all these rules. And then we should all go to a meeting place. So have a meeting place, whether it's the mailbox, the light pole, the fire hydrant, flower bed, can be anywhere, just someplace everyone goes. We take attendance. And if we haven't called 911 yet, we call 911. And if there's anything in the house, be it a person, a pet, anything inside, we do not go back in. Get out and stay out. That's a big thing. People that go back in don't end up well in most situations. So we want to get out, stay out, call 911. When they get there, let them know what's inside and what happened. Okay, so that's just a basic home escape plan that a lot of people just sometimes either brush up on or maybe haven't heard that information. There's more specific things with seniors and different things we can talk about depending on the type of home you live in. But I just, make sure we keep those smoke detectors in our houses. Also, carbon monoxide detectors in most places, we need those as well. Keep those things, keep the batteries in them. And I would say keep our doors shut at night if we can. And then just follow that escape plan. And that's the basics of it. So I just wanted to cover that first. And I think that is all I have on that. So we'll stay the questions to the end, we said? Okay. Okay.
I mean, if anybody has any questions specifically to smoke detectors right now, I guess it's probably Carrie.
So I actually have a strobe light smoke detector, which is, as you mentioned, the 10-year combined battery hardwired. And this is more comment than a question. So it went off defectively. And I just want to say that, though it would be hard to imagine a situation that product did not get someone's attention because it is very disruptive. The strobe lights are very strong. And I know in my instance, my husband and I'm hearing impaired. He is not. Both of us, jumped out of our skin in response to that while we were sleeping. So I just, I learned from that experience how good of a device that was as far as getting your attention. But in the example that I'm using, it is actually in our bedroom, and we have another location where it's actually outside our door. So I have to think about what you said, honestly, John, about sleeping with the door closed, about whether I would do that or if I would want it open so that I can see the strobe, when it goes off.
Yep. And that's why I said, you know, in some situations, that's not the case. You know, like if that's your best way of getting alerted, then maybe that's the best thing to do in your situation, for sure. Yep.
Now, I just want to say, I'm not hardwired, but I have sensors that go to an alerting system that vibrate under my bed. And I mean, it's never gone off at night, thankfully, but I know, like, for instance, if I'm cooking something and the smoke detector goes off, you know, and of course I have my cochlear implants and I can hear the bed vibrating. And my neighbors downstairs certainly can, but
Oh.
So I can talk about that now briefly if you want. So I did a little research on this again, and someone here may have a lot more information. You probably have these systems yourselves about the. I actually read it. The National Fire Protection Association did a report that came out in August of 2021 on different alert systems. It's I don't know if anyone's seen it, but it's a 70-page document. That's a research document. It's very, very good. So it's only 3 years old, but you know the data is probably as current as we're going to get. And they said the recommended thing is still the bed shaker type system. And they recommended it be portable. That is the most tried and true thing. Now, again, this is 3 years old information. I know they make the bracelets and watches and a lot of other different things you can wear now. So that technology may have outpaced this study. But those things are still available, and that's what the NFPA recommends. And again, if you just do a Google search of NFPA hearing impaired detectors, that will pop right up, and that's a really good resource of information if you want to get some actual factual, you know, studied information from a reputable source. You can find some information on that. But there's the strobe detectors. There's also smart detectors now, which is what we're talking about, ones that would alert you onto a watch or some other system. I don't know if that's Nest. I don't know who's making those at this point, but they do exist. As well as low frequency detectors that they make as well that do work as well. So depending on what your hearing situation is, and again, you all may know a lot more about this than I do. Those things are all available. But again, that resource from NFPA is really good.
Yes, I would like to ask you a question. So, this is what I do for a living, and I always do a lot of research on finding things for products that are for people with hearing loss. So, is there anything that you would recommend, or do you have anything to share that will be useful for people with hearing loss or deaf? Such as like anything that people can buy from Amazon or something?
You know, I don't. That's not my area of expertise. This is the first time I've really dealt with this. I did reach out to our EMS officer at work because he deals with a lot of home issues. But he as well didn't have much information. I don't know if John has more information on these things, but that's why I just did a bunch of Google searches and read some articles and some research and clicked on links and just tried to find what I could find about it. So I'm not an expert on those systems, but to say that there are several out there, and you know, you can do your research and see what's available. And I know there are agencies, and you probably know better than I do who those agencies are that help people do those kinds of things. And your local fire department, if someone in Waltham wanted us to come out and take a look and offer some suggestions and help them out, we would certainly do that in Waltham. So reaching out to your local fire department might be a great thing to do as well if you're not in Waltham.
you know, I know you're low, I know the PowerPoint that I'm gonna share afterwards does have some resources, but Carrie, and Laura's had her hand up. Can I let her ask her question first? Okay, Laura. But you're muted. You're muted. You haven't on your phone, but you're muted.
You need to unmute your camera.
Unmute, you're
There we
muted.
go. I had the Red Cross come out and specifically get me something that has the bed shaker for those with hearing loss, because when my cochlear implants are out at night, my husband is traveling. I had a different system with a baby crier and flashers and things, but those fail. And I've been through so many of them. So I was looking for something better. This is called Lifetone.
Lifetone.
Lifetime, okay.
And it's, you know, it's essentially a clock radio, fire alarm with the bed shaker. And it is really loud also, not that I hear it at night. In fact, So I'm a little disappointed and need to know what to do. Because it came from the Red Cross, I don't have any type of receipt or warranty, but the bed shaker actually had a failure. So it started talking at night and my husband was freaking out because it was saying, check bed shaker, check bed shaker. And so if he'd unplug the bed shaker part, it would stop, but obviously I'm not safe then. So it's an excellent product. I just need to troubleshoot it now.
I know it's a lot of the fire departments will give that out. I remember when we were with Watertown, they had 2 of them they were giving out to people. But, all right, why don't we take 2 more questions? I know Carrie and then Ann has her hand up, and then we'll go on to Officer Baily. Will that work? And we'll save all the other questions for last. All right, Carrie, your question.
Well, I think Anne, do you want to take Anne first? I think she had her hand raised.
Ann. But you're muted. No, you're muted though. You can ask, but you got to unmute.
All right, John, my smoke detectors are hardwired, but they've been in for a long, long time. Do I need to pay attention to, I think somebody said 10 years.
Yep. So 10 years on a smoke detector, it's actually 7 years on a carbon monoxide detector. But it's a combination detector is also 10 years. So basically 10 years is a good rule of thumb. If you take your detector off, on the back of it, you will see a manufacture date. That's the date we go by, not the one that's written on the side of it. It's 10 years from date of manufacture by the code. So that's what you want to look at. If you don't see a date, that means your detector is definitely more than 10 years old, or it was something that didn't meet the code, because everything that's met the code for the last 10 years has a date on it in a UL listing and all that kind of thing. So every 10 years is the way to go on that for sure.
Okay, but
you live in Massachusetts?
yes, yes, in Natick.
So you can call the Natick Fire Department. There's a good chance they get a grant from the state to replace detectors in seniors' houses, and they'll probably be able to come out and do it for free.
That's awesome.
So
Thanks.
any senior in Massachusetts, I would call your local department and check that out.
Okay, thanks, John.
Go ahead, Carrie. Unmute. Carrie, unmute it.
Carrie, no, yeah, Carrie, you're next. Sorry. I was telling you to
thank you.
unmute, unmuted.
Go ahead.
So just a question, so my mom had asked me, John, whether there was something she could put on her condo door to indicate to fire, if there was a fire in the building, to indicate to the fire folks that she was hearing impaired. So is there such?
I'm sure there is. There are certain stickers for things like that. I'm not specifically aware of one, but I'm sure they make one on Amazon, and that wouldn't be a bad idea. To put it on the front door maybe, and then also on the bedroom door to let people know that. Yep. And one other thing I would say is I know in Waltham, if we know someone's hearing impaired, we can put notes in our 911 system.
911, right.
And so that's what I would also recommend, because then on dispatch, they're going to let you know that there's a hearing impaired person at the residence. Which is really
I
good.
actually have a note on mine, supposedly, and I call periodically just to make sure it's still there.
Yeah.
And all right, Linda, you had a question, and then we'll go to Jon Baily. Okay.
I actually saw Linda just had her hand raised. So Linda, if you want to ask the question, please unmute yourself.
That was, my question was answered, my comment was answered about the 911 system, that you can put your information into the 911 system.
Thank you, Linda. Is
Okay,
there anyone
so
else?
go now to the police department. Okay.
All right. But before I start, I just want to address Carrie about putting an indication that there was somebody either deaf or hearing impaired in the house. I don't, from a crime prevention standpoint, I don't like that idea, because now we identify a vulnerability. So I don't recommend that. But that's my speech on that. I also want to apologize for not having a camera, and that's shame on me. But my computer that has the camera wouldn't let me get into Zoom, but, so this was a last minute thing, but, so I do this, every day for work, but I also live it every day. I have a 32-year-old, profoundly deaf son, deaf from birth, so I've lived through this whole thing for the past 32 years, so I have a different, perspective on it as well. And his fiance is, hearing impaired, so, and they're both here. So I come from a crime prevention background. So that's kind of what I'm going to address tonight, and I'll kind of focus primarily on home security and safety. With a lot of things that are going on today, products out there, smartphones and so forth, smart watches, and the web-based camera systems are now so inexpensive. I hear a lot of people talking about the bed shaker. My son used it for a couple of years, and he doesn't like that anymore. That's probably an age thing. They're all into the smartphones now. By the way, he has a cochlear implant, has since he was 3. But he has on his phone and his watch our Ring doorbell system, so that if somebody's ringing our doorbell, that'll wake him up at night because it'll shake his wrist. He also has, and when he's walking around the house, if he does not have his cochlear implant on, that will also notify him when somebody's at the door. I also recommend the other type of web-based camera systems. They do have the Ring for the outside as well. And that is an indication, especially if like you're asleep at night. And I'll utilize my son in my presentation because, like I said, I live it every day. When the camera system goes off in the backyard, that also wakes him up. So anytime something is going on around the house, he's alerted as well. So it's not like when he was younger and he was down the hall from us, and we do have the smoke detectors with the strobes, but if there was something else going on in the house, he gets alerted to that as well. So I'm a big proponent of web-based camera systems that hook up to your smartphones. I know an aging group is not a smartphone group. My 83-year-old parents just went smartphone. So there is hope. And that's kind of the way to go these days. We're seeing more and more products coming out for all different types of groups, autism and so forth. So these things that are all web-based and smartphone-based are becoming more and more prevalent in the deaf community as well. Another concern I have is, even along the lines of with a fire. I think we had mentioned that we can notify the 911 center, a dispatch center, of any sort of we call them disability indicators, which is an old-fashioned term, but we can put your information in there, your address, as opposed to putting it on the front door, like you had mentioned, Carrie. We can put that in our system so that the police and fire, when they get dispatched to a call, that comes up on their computer-aided dispatch system in their car and in the fire engines, the apparatus. So we have that information as well. One of the other things because I deal with the elders a lot, is if you have a garage door opener and you have a passcode, passcode for that, you can provide that information to us, so we put that in our system as well. So in case there is an emergency, and if you have a hearing aid or a cochlear implant and you don't have any other way of being notified, at least we have emergency access to your to get to you in case of an emergency. We also have the 911 code red system now, which is like a reverse 911. that you can sign up for. And it's not only landline based, so you have to be hearing. It's now text based. So you could get text messages on any emergencies that might be relevant to your area. That's in Waltham. I'm sure a lot of other communities have that as well, or something, excuse me, something along those lines. So that's kind of what I wanted to focus on. Oh, one other thing, motor vehicle stops. That's a big thing these days, with especially with deaf and hearing impaired. What to do when you get pulled over by the police? It's really simple to just put your two hands on your dashboard, on your steering wheel, and wait for the officer to come to your car, and then just make eye contact with them, and just signal that you're deaf by pointing to your ear or vocalizing it, and that will kind of ease the officer's stress level and kind of make the stop go a little easier. So those are two things that I really wanted to touch on tonight. So, and I'd be happy to entertain any other questions that anybody might have.
I do have a question. John, thank you very much for sharing that. There's so many things I would love to ask, but I know that we don't have that much time. But it's just it's amazing of how you're saying everything about the technology, where technology does help everything, especially people with disability, hearing loss, and deaf. As what I asked earlier to John from the fire department, and you already mentioned it, technology. Is there any other useful products that people should have or could have that will make every officer easier?
Yeah, so the Mass Commission for the Deaf and Hard of Hearing has produced different types of cards for both the officers to carry with them and for the deaf and hard of hearing to carry with them, to make basic interactions a lot simpler. Especially like at a car stop, there'll be a type of card where you would just point to your license or your registration, or something along those lines. And then the police officer would have a card that would indicate to you reason for the stop, whether it be a red light or person in a crosswalk. She has it right there. Carrie has it. Yep.
Carrie.
Yeah. So there are those types of visual aids that we have. But there's also the language line on, again, smartphones that you can. Yeah, oh yeah, there you go. There's also
everything prepared. Let me tell you that Carrie had everything prepared.
There's also an item called a pullover pal, which was invented by a guy, I believe, in like North Carolina. My son's a big car guy, so he actually did a promo video for him. So it's a type of a visual aid for car stops called pullover pal.
Oh,
they're out there, but they're just what we find often is that when we are involved in a situation like that, that's the time we can't find the card. Because we don't have an awful lot of interaction with deaf or hard of hearing people. We don't.
What about because I was sharing some information with Carrie Silverman, who is the president of the HLAA, and one of the information I shared with her was the New York Police Department are actually taking ASL classes. Are you guys doing that the same thing too?
We do have officers that do go through some ASL classes, but like any other language, if you don't use it, you lose it. I have I guess luxury, you would call it, where I have to use it somewhat on a regular basis, because sometimes he can be stubborn with his cochlear implant. And I have to then resort to ASL. But yeah, we do actually offer those classes through the Mass Municipal Police Training Council. They're constantly doing specialized training for police officers and how to deal with deaf and hard of hearing. So they're out there.
Amazing. Thank you very much. I think Catherine is next. Go ahead, Catherine.
Well, thank you both, Johns, for being here. This is informative. I'm pretty techie, but I didn't realize there were so many smartphone advantages or whatever. But my question is, to notify I'm in Arlington PD and Arlington Fire. Who do I contact to get into both databases? Are they cross-linked?
I'm sorry, both databases, the emergency dispatch database?
Well, I want to alert the town that I have a severe hearing loss, my address, phone, and that type of information. Who do I call? Do I call the... Go ahead.
I can tell you, Kathleen, that in Waltham, which is probably going to be the same as Arlington and any other community, if you contacted your 911 dispatch center,
Yes.
they would probably be able to put it in the system. It's a system that both police and fire share. It's called
Good.
computer-aided dispatch.
Thank you. Answered. Thank you.
Does anyone else have any questions?
I have a PowerPoint that I put together, that of course goes over a lot of this information. Well, actually, Jonathan put the PowerPoint together. I had the information. He made it a little more presentable. Anyway, so does anybody have any objection now? I'll put that on.
Okay.
Okay. Screen share. Hang on one sec. Desktop. Why is it not allowing me to share my desktop? Jonathan, can you access it a little bit easier than I can? Because it's telling me I can't share my desktop.
Absolutely. I will share right now. And while I'm doing it, Linda has a question. So go ahead, Linda, while I get things started.
Okay, I have a question for John. I know that there are cards for the police department, and I believe that our fire department I'm in Indiana, has also requested this type of card. Is that something that's going to be done in Massachusetts as well? And what kind of things would you put on the card that you could interact with someone? Because I'll be honest, if I have a fire and I get out of here without my processors, I'm not going to hear. Somebody said, well, they can lip read pretty well. I'm like, we're in a high stress situation. It's like, I don't know how well I'll do.
Are we talking about notifying 911 or?
No, I'm talking about when the firefighters come to my house.
Oh, to
And
communicate.
there's a fire and I've gotten out, hopefully, and maybe they have questions for me. I mean, I'm assuming that some of the things that they'd want on a card, is there anybody else or pets in the house? Is there anything like that being developed in Massachusetts or that you're aware of?
What you're saying, I'm not aware, but that's a good question, something I could look into. I don't know if John knows more about something like that, but that would make sense to have a card you could bring out of the house with you. You know, yeah, that makes a lot of sense. I haven't heard of that. No.
So I can talk a little bit about that. We have what's called the File of Life, which is a magnetized envelope and one that goes in your purse that has your medical information, your doctor's information, your hospital information, any special requests. We generally use those for elders, but I've used them for all different age groups and other demographics for other things. It's also a great card for anybody that has any sort of issue going on, like you had mentioned, where it's a high stress situation. You could just hand them the card and it would have just about all of your health information, and there's a spot for notes that you could say, I have a cat, check the house for a cat. I have a dog, my husband's bedridden, or any other sort of note that might help us in an emergency situation. That's what we have in Waltham. It's a national program that was designed by a gentleman out in Springfield, Mass, but it's a national program. So if anybody would want any of those guys, I can get you one of ours for you to use. So that's not a problem, but you might want to check with your communities as well.
I don't see any other hands right now, but I just have a comment to make. I had a very weird situation happen a bunch of years ago. My dog disappeared. Must have been around 10 o'clock at night or whatever. My neighbor knew that my neighbor had the key to my house. My neighbor also knew, the dog. I had called the police at one point, and by midnight, I must have fallen asleep. Anyway, fast forward a few hours later, my neighbor decided to the police found the dog, brought him back to the house, and my neighbor decided to let the policeman in. Now I'm sound asleep. I have nothing on. So I'm nothing on my ears, and I'm completely deaf at night. So, here comes the problem. How do they wake me up? I mean, I got to admit, the officer was on the other side of my bed and he was flashing the light in my eyes. Eventually I woke up. For some reason, I didn't panic. I don't know why. Maybe because I knew the dog was out there and I just, so it's just things like that, it's just kind of an awareness too, that, and I kind of signaled to him, I have to get my ears in, and I put my ears on, and I was fine. But, why I wasn't scared beyond anybody's imagination is beyond me, but I wasn't for some reason. But it was just one of these weird situations. And then another time, I was actually out in California at a hotel, and I asked for an accessible room. They didn't have one. So I just simply told them, I said, look, I have hearing loss and I'm deaf at night. I mean, this probably the slim to none this is going to happen, but I just want to let you know. I was on a room on the second floor or something. Sure enough, the next morning, and this happened to be right across from Advanced Bionics, and that's the maker of my cochlear implants. The next morning I walked downstairs and someone had said, and they were talking in it was Embassy Suites where everybody eats together. And I heard people talking about, oh my God, can you believe what happened last night? Blah, 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 blah. So I said, what happened last night? They said, what do you mean what happened last night? We were all called out in the fire alarm. And I slept right through it. No one woke me up. Well, you can imagine I changed my hotel the next day, and Advanced Bionics doesn't use that hotel anymore. But it was just, again, one of these crazy situations, and it was, fortunately nothing happened. People evacuated. It was, I don't know what the problem was with the fire, but it clearly wasn't a real fire. And everybody went back and went to bed, and I slept soundly through it, but it could have been a disaster otherwise. So it just makes you think about this. So, I mean, I put in the PowerPoint that Jonathan's going to have, I have something that I bought now, and it's a portable smoke detector that I bring with me when I go places. And that might be because of my paranoia, but I bring it. It goes in my suitcase. So anyway, are there any other questions? If not, I guess we'll have Jonathan share the PowerPoint again. Okay. Did we share the PowerPoint, Jonathan?
Okay, can anybody see the PowerPoint? Thumbs up?
Yes.
Yep.
Awesome.
Okay,
Okay, so why do you go ahead and start?
okay, well, since you have control of it, you can get to go, you
I
change
do.
it, and then,
Yeah, just let me know when you're ready to go to the next slide.
okay, I think we're ready. I mean, it's just says emergency preparedness and safety with hearing loss. Okay. I mean, I'm just going to basically read it, but basically communication barriers are a constant threat to people with hearing loss. I mean, we have some extra needs because obviously communication is a major issue, especially in an emergency. If we're caught unaware and without supplies, then we're really, then we're really in trouble. I think most of us will probably do okay in a daytime setting because, we can hear somewhat, or completely. Anyway, but the inability to hear alarms, sirens, verbal instructions, including a knock or a doorbell in the middle of the night from emergency personnel about evacuation can lead to delays in responding appropriately. You know, we all respond differently. I mean, it's like, I like the bed shaker, somebody else might like a strobe. You know, whatever the situation is. I have a dog that wouldn't let anybody into the house. So that's my newest issue, to try to have to figure out how I have to deal with that. But, you know, I mean, in an emergency, if somebody honestly were to knock the dog out or tranquilize the dog or something to get into the house, so be it. But I mean, anyway, so there's just all these different scenarios that we all have to kind of think about. Okay, anyway, Jonathan, I think the next one. Okay, keep going. So these are some of the situations I put together through, again, various sources. I did it a bunch of years ago. They probably need to be updated with smartphones and all these new technology, but anyway. Supplies at home or if you're leaving. This is just in general. Emergency contact information, copies of important documents, prescription medications, hearing aids, CIs, eyeglasses, phone charger and a battery pack, because that's important. Because if you go out with your CI and if it's anything, if you're like me, mine goes in the dry egg kit at night with the old battery on it, which means if I put it on in the middle of the night, I'm probably only going to have another hour or so left of power. Cash, face coverings if you need it, whistle to signal for help, diapers, wipes, baby food, formula if needed, pet food supplies, vaccine records, tagged crate, you know, if needed, and I would say pad and paper or some way to communicate. Now, maybe you can use your smartphone and just, you know, write what you need, but without devices, you're really left up to your own device. Okay, next one, Jonathan. Okay, at-home supplies if you're sheltering in place, quarantining, isolating, bottled water, 1 gallon per person per day times 3 days, canned foods and foods that don't go bad, manual can opener, you know, anything that doesn't require power that you might need. Flashlight or lantern with extra batteries, first aid kit and a thermometer, battery powered radio with extra batteries, matches in a waterproof container, household cleaner and disinfectant. It could be something as simple as hand sanitizer. Okay, next one. If you're going to evacuate, change of clothes and sturdy shoes, communication tools. Again, there's your pad and paper or whatever else you're going to use. Medical supplies if needed, personal hygiene items, sleeping bag and blanket per person. And that may not be as critical because if you are being evacuated, most likely where you're being evacuated to will have those kind of supplies. Okay, next. Okay, now this is the hearing loss emergency kit, specific for us, obviously. Flashlight and batteries. So if someone needs to see you or you need to see someone else, you can hold the flashlight up to their face. This may help also in a car. You know, I know John mentioned put your hands on the steering wheel, and then point to your ear, so you know that so you're letting people know that you do have a hearing loss or you're deaf. But you know, oftentimes what happens at night if someone pulls you over is the flashlight's right in your face. Well, if the flashlight's in your face, you're not seeing anybody's face any more than they're seeing your face. And if you're not hearing, then you've got a problem there. So you do need to have some way to at least tell people. Anyway, disposable batteries for hearing aids and cochlear implants. And in a cochlear implant case, canisters to attach these extra batteries. Like I can use a rechargeable battery in my cochlear implants, but I also have disposable batteries I can use. I know a lot of rechargeable hearing aids, you can't do that. But whatever your device has, you need to bring extra. Backup battery charger, a portable battery charger bank, powerful enough to keep the devices charged. Some of these can work through your car batteries. Some of these you need you need something that's been charged up. It's just a portable battery charger. Extra cables, microphones, and supplies needed to keep your specific device in workable order. Extra hearing aids or CIs if you have one, and cell phones for communication. Okay, next.
I would like to add before we go to the next slide that like even though there's not an emergency kit, but I think that goes for everyone, that whenever we travel, we always bring extra something. So it's a thing that it's the same thing as an emergency kit. Whenever you're traveling to in the outside of the country or whatever, we always bring our extra batteries for the hearing aids. So just think that as an emergency kit.
Okay, next one.
Yep.
I know I'm going through this fast and we can talk about it afterwards and I'll be glad to, send these out to everyone to see them. So, okay, technology helps. low frequency sound signals for those who can't perceive high pitched sounds. And high pitched sounds are the first things people lose, especially at night. And smoke detectors are kind of miss those low frequencies that we can hear possibly at night. Fire alarms with strobe lights, smoke detectors with strobes, vibration-based alerting systems, wearable devices, smartphone apps that can transmit emergency alerts through tactile and visual means. Now, I know for a fact, if somebody shakes my wrist at night, I'm not going to wake up. I don't care how powerful that watch is. So I need something under my mattress that's going to shake the whole bed. You know, and my neighbor downstairs complains, and I'm like, tough luck. You know, I mean, there's nothing I can do about it. But anyway, like I said, everybody's going to have their own preference based on what their needs are. So, okay, the next one. Devices for individuals with hearing loss at home. Fire safety alerts, most work with existing smoke detectors or hardwired fire, you know, I mean, a hardwired device probably costs between $600 and $800. So obviously the, you know, the alerts, you know, like the what do you call it? The sensors that go on your existing smoke detectors are a lot less money, but it depends again on your level of comfort. They're probably more prone to breakage. Weather alerting system, some hook up to alerting devices and provide alerts and closed caption messages with flashing lights and vibration. Cell phone apps with NOAA, which is the National Association for the, I don't remember, it's a weather service. I don't remember the actual acronym, but anyway. Assistive communication devices and alerting devices. Again, I listed Diglo or Harris Communication, but Amazon sells some of these things. Diglo is a great resource because they deal specifically with devices for impairments, for hearing loss, for visual loss. Mostly it's hearing loss. And if you really need to pick their brains, you can. I needed, for instance, I need a specific alerting system that had a 48-hour battery backup. And that was because I don't know if you remember, I think it was Hurricane Irene. It happened the end of August, and I work in a school and I needed to get up for school that morning. So I needed something that was going to wake me up that, you know, that morning with a battery backup if the power went out, and the power was out for the week. So, I mean, it's just, so Harris Communication, which is now Diglo, is the one that helped me with that. I must have spent 2 hours on the phone with the person. Anyway, all right, Jonathan, next one. These are just some resources. I don't need to repeat them. I think you can read them, but if you go down to we have the life tone listed, and I thought I listed the smart. You know what? I can add that in. Remember, I said I have a stay awake alert that goes with me. It's a smoke detector for a hotel, but it's called. Oh, I do have it. It's sorry. It's number 7. Safe awake smoke alarm aid. I think it costs like $250 or something. And to me, it's like I said, it's just for my peace of mind after going through that hotel with the, you know, with the alarm that I slept through. But, you know, anyway, I think, was that the last slide, Jonathan? No, yeah, okay. That's basically the last slide. All right, so I guess you can stop screen sharing, and if any other questions, we can just answer questions.
Can I just say, on the emergency preparedness, I did a round table with a FEMA representative and a CISA representative. That's the cybersecurity CISA branch of our government, and their websites have a lot of information on emergency preparedness. I don't think there's going to be a ton that is hearing specific. But if you're looking for lists and things, especially about cybersecurity, a lot of it gets into some crazy stuff. But there's a lot of links. There's little training things on there. It's a good place to look to find some information on that kind of thing.
Anybody have any more questions, comments? Linda, your hand is up.
It seems to me that Liz has a question, so Liz, if you could please unmute and go ahead.
Linda, Jonathan, Linda was going to talk first. She had her hand up, and then Liz,
I
your
had a-
second. Okay,
Oh, I'm sorry.
that's okay.
I had a quick question. I know I've been talking to some people over in Indiana, and I'm wondering if we shouldn't include having your backup, like if you have an old hearing aid that still works, but you bought a new one, maybe a battery recharger, whatever you have, put it in a safe along with your documents in case of a fire. Like a small firebox.
Not a bad idea. You know, I mean, I know a hearing aid wouldn't work with me, but I mean, I do have extra cochlear implants, so that would certainly, you know. All right, now Liz, sorry. Your turn.
No, I just, I know everything is so technological, especially when we talk about hearing aids and smoke detectors. But basic A and B, carry a pad and a paper, pencil or writing utensil. You can't speak it or you can't hear it, write it down. Sorry, I jerked the mouse back. Did you understand all of that?
Yeah, I mean, some of this you just have to kind of go back to basics, you know, kind of
Yeah.
old school as, you know, as we call it. And I think most of us are at the age where we know what old school is. You know.
Yeah, sometimes the
You're all
old
today and they
school,
won't have a clue what you're talking about, but that's beside the point.
old school always works because not all the time the technology works. So we have to do the old school way.
Any other
Uh,
questions out there? Comments? Follow up, anything? Well, I
And
mean, you know, I mean, we've been on for about an hour, so it's up to you which direction we want to go. If no one has anything else to say, you know, I mean, I know this has been informative. It's, you know, it's like I said, I've contacted the, you know, dispatch in my community. I live in Waltham, and they do have my phone number. They do have information. I also have a lock. Well, actually, I think I got to change this now because I have a touchpad in the front of the house and I have a lockbox with my key in it in the back. And they know to go into the back with a lockbox. But now that I have a touchpad, there really shouldn't be any reason they couldn't, you know, come in the front. But I do call dispatch periodically. I just want to make sure that. And if nothing else, I mean, I haven't had to use it thankfully, but it's just peace of mind. And I know about 5 years ago, we had my house, I live in South Waltham and all the houses are very close together. There happened to be a fire 3 houses down from me, and the houses are so close together, it was a 9-alarm fire. So it meant we had at least 9 fire trucks here, and I think we had 3 other towns. It was crazy, but you know, I mean, it was during the middle of the day, so it was fairly okay in terms of people getting out, but it could have just as easily been at night. You know, and like
So
I
when
said,
you
my
say,
incident with the hotel, I mean, I'm a bit paranoid when it comes to staying in a hotel room now. That's not anyway.
so when
This is,
you said you called dispatch, do you call 911?
I don't think I called 911. I think I called the non-emergency number and they connected.
Okay, that's what I'm trying to figure out. I got it.
I just didn't want to call 911 because it wasn't.
Oh, I
really,
agree.
you know, I mean,
Yeah,
I don't think the
The
two.
911 center has a non-emergency phone number as well.
And how do I get that?
Are you in Waltham?
No, Arlington.
It would be on the
Probably,
website.
yeah, the City of Waltham website, City of Arlington or Town of Arlington website should have that direct line non-emergency.
Oh, thank you. Never thought to look that. Thank you.
Okay, and I'm sure for those of you who are in Indiana, I'm sure it's the same thing. I'm sure most 911, you know, and now what's nice is most of our areas have what's called enhanced 911. So whether we're calling from our cell phone or calling from a home phone or calling from a captioned home phone. I mean, that's the only reason I still have my home phone is it's captioned. So at night when I have nothing in and I am totally deaf, I know that phone is right there and wired in. I mean, though I can probably do the same thing on my cell phone, but you know, it's just, again, it's just one more level of protection, one more peace of mind. You know, and if my neighbors are upset about it, you know, so be it. I mean, I can't do anything about it. It's who I am.
So you just brought up an interesting point. If you call 911 from your cell phone, that goes to the state police. So I would suggest that if you're looking to store the 911 or the emergency dispatch center in Waltham in your cell phone for 911, you want to use the non-emergency. It's the same location. It's just the non-emergency. Otherwise, you're going to be calling the state police for an emergency from your cell phone.
So what is that again? You said
So
call the
yeah,
dispatch.
so cell phones all go to the state police
Right,
because we don't know where your cell phone is located in. It goes to a tower, correct? So what I would suggest is on your cell phone, you program in the non-emergency Waltham emergency dispatch number for your local 911. So when you call that, it's going to go to the Waltham Emergency Dispatch Center, not the state police.
Thank you.
that makes sense. Okay.
Go ahead,
Laura,
the-
Laura has a question.
That's kind of what I wanted to mention because I know a lot of us have moved and we've kept our old cell phone numbers. Or there's so many other options like Google Voice right now for my landline phone is actually a Rhode Island exchange because I got tired of all the New Hampshire political calls. So when my mother called me from Connecticut with an emergency, I was trying to use my captioned landline Google Voice to call 911 for her, and it wouldn't go because it had a Rhode Island exchange. So I had to use my New Hampshire cell phone, which I don't hear that great on. And then New Hampshire connected me to the Connecticut. So it does get convoluted when you're in the moment and you're not thinking clearly. That I was not realizing that the 911 was seeing Rhode Island exchange.
Now, I have a question. I work in Newton, and I remember dispatch. I'm actually a school nurse, so I mean, I deal with the police and fire a lot for emergencies, and I remember dispatch saying to us that now Newton has the ability, even if somebody calls on a cell phone, they can triangulate or whatever the word is. They can determine exactly where that cell phone's coming from, even though it goes to the state police. Is that true?
Yeah, that's true. You can triangulate, but it's not an exact.
Okay, all right. That's good to know.
They're supposed to be able to implement that it goes to the local 911 center, but that's just not where it should be. So that's good advice from John, is to put the non-emergency number in there for sure.
That's really good advice. Okay. Because I'm gonna update this PowerPoint, hopefully. But, okay, does anybody else have any more questions? Okay, then I'd really like to thank both John and John because you guys were really informative, and hopefully we all learned something from this tonight,
Yeah, anyone from Waltham, we do home consultation, so we can come out and take a look at your stuff and see, we can give you some thoughts, and if you're a senior, we can do smoke detectors if you need them. We don't have any of the hearing impaired stuff, but I could honestly look into maybe getting some of that with some grant money or something as well. So yeah, so Sue has my contact information, of my email, my phone number are on the Waltham Fire website. I'm easy to find. So if anyone needs anything, let me know.
So who would somebody call in another community?
Is on the fire end of it, their fire prevention office, if they have one. Most cities and towns have them. If you're in a really, really rural area, it would just be the day line of your local fire department or 911 center, depending on some places have a combined, police and fire department in a lot of places. So I don't know what people's situation is, but whoever's responsible for your emergency response, they'll whoever you call, they're going to get you to the right person,
All right. Well, thank you so much. This has really been informative. And I have a quick question for anybody that has absolutely nothing to do with this. Who is Carol and what is her autopilot? Anybody have any idea?
I
Okay.
have no idea. I'm consciously trying to accept it, but so far I think that person has no idea because I see 4 autopilot going on.
Well, autopilot is something, if you ever use Otter, which is the captioning, for a cell phone, an Apple, what do you call it, for an iPhone. If you ever used it and you've ever put it on, somehow the autopilot is the AI device. So there's a way to shut it off. I Googled it once, I figured it out. I have no idea what it was though. I mean, so I got a sight out of mind. But I just don't know who Carol's autopilot is because there's no Carol on this call. But anyway,
Okay, she's registered to be here. I would just let it be for now.
all right. Well, that's not the end of the. Okay, well, listen, John and John, thank you so much. This is very informative, and yeah, we'll
Thank
see you
you.
later. Okay.
Nice meeting you all. Thank you.
Okay,
Thank
Thank you very much.
yeah, bye bye,
Bye.
everybody.